Chapters 30 through 37. When the chest impacts the steering wheel during a motor vehicle crash with rapid deceleration, the resulting injury that kills almost one-third of patients, usually within seconds, is aortic shearing. Kills one-third of patients, aortic shearing. Signs and symptoms of a chest injury include all the following except hematemesis. During your assessment of a patient who is stabbed, you see an open wound to the left anterior chest. Your most immediate action should be to cover the wound with an occlusive dressing. When caring for a patient with signs of pneumothorax, your most immediate concern should be ventilatory inadequacy. What purpose does a one-way flutter valve serve when used on a patient with an open pneumothorax? It allows the release of trapped air in the pleural space. Signs of cardiac tamponade include all the following except collapsed jugular veins. A patient experienced a severe compression to the chest when trapped between a vehicle and a brick wall. You suspect traumatic asphyxia due to the hemorrhage into the sclera of his eyes, and which other sign? Cyanosis in the face and neck. A 14-year-old baseball player was hit in the chest with a line drive. He's in cardiac arrest. Which of the following is the most likely explanation? Commotio cordis. Paradoxical chest movement is typically seen in patients with a flail chest. A 40-year-old man who was the unrestrained driver of a car that hit a tree at a high rate of speed struck the steering wheel with his chest. He has a large bruise over the sternum and an irregular pulse rate of 120. You should be most concerned that he has injured his myocardium. What is ventilation? The body's ability to move air in and out of the chest and lung tissue. When a patient sustains a spinal cord injury above the C3 region, which of the following is likely to happen? Loss of the ability to breathe due to loss of ability of phrenic nerves to function. You're assessing a patient who sustained a blunt force chest injury during a motorcycle accident. There are no obvious signs of external bleeding, but the patient is hypovolemic and there are decreased breath sounds on the left side. Which of the following should you suspect? Hemothorax. Which of the following are you likely to see in flail chest? Paradoxical motion. What are the two most common injuries caused by penetrating chest trauma? Open pneumothorax and cardiac tamponade. What's the best position to place a patient when you assess for jugular vein distension? Sitting at a 45-degree angle. When you're assessing a patient and notice he has a collapsed jugular vein, what does this indicate? Hemothorax. You are treating a patient who fell hard on her right side off a bike. Exposure of the patient's chest reveals a large bruise on the lateral aspect of the right side of the chest. When you palpate the area, the patient yells out in pain and states she cannot take a deep breath. What should you suspect? Rib fractures. Which of the following blood vessels can be lacerated by a fractured rib? Aorta. In which condition is it recommended you use positive pressure ventilation? Flail chest. Bruising over the right upper quadrant could indicate injury to which of the following? Liver. You should have an index of suspicion that a patient with pain referred to the right shoulder has an injury to which organ? Liver. Which of the following are considered solid organs? Pancreas and spleen. Which of the following signs would indicate that an injury to the kidney has occurred? Hematuria. You're assessing a patient who reports pain that is tearing and describes it as going from the abdomen posteriorly. What should you suspect? Dissecting abdominal aneurysm. What is the major cause of death in hollow organ injury to the abdomen? Sepsis. What is the purpose of wrapping a sexual assault victim in a burn sheet? To preserve potential evidence. Which of the following is an indication of an injury to the spleen? Referred left shoulder pain. Which of the following statements is true? The higher the velocity of a projectile, the larger the cavity it produces. Where is abdominal injury most likely in young children? Liver. Peritonitis would most likely result following injury to the stomach. Which of the following organs would be most likely to bleed profusely if severely injured? Liver. Which of the following statements regarding intra-abdominal bleeding is false? The absence and pain and tenderness rules out intra-abdominal bleeding. Even when seatbelts are worn properly and the airbags deploy, injury may occur to the iliac crests. Whilst inspecting the interior of a wrecked automobile, you should be most suspicious that the driver experienced an abdominal injury if you find a deformed steering wheel. Other than applying a moist, sterile dressing covered with a dry dressing to treat an abdominal evisceration, an alternative form of management may include applying an occlusive dressing secured by trauma dressings. You are transporting a patient with possible peritonitis following trauma to the abdomen. Which position will he most likely prefer to assume? Legs drawn up. A 16-year-old boy was playing football and was struck in the left flank during a tackle. His vital signs are stable, however, he is in severe pain. You should be most concerned that he has injured his kidney. The term hematuria is defined as blood in the urine. When caring for a female with trauma to the external genitalia, the EMT should use local pressure to control bleeding. When assessing a distal circulation in a patient's lower extremities, which pulse should you palpate? Popliteal. Which MOI causes a fracture or dislocation at a distant point? Indirect force. What's the most reliable indicator of an underlying fracture? Point tenderness. A disruption of a joint in which the bone ends are no longer intact is known as dislocation. In the musculoskeletal injury grading system, under which category would you place a laceration of a major nerve or blood vessel? Serious. Which of the following would you use to stabilize an AC separation? Sling and swath. You're attending a patient with a non-displaced elbow fracture. She has a strong pulse and good capillary refill. How should you address this type of injury? Splint from the shoulder joint to the wrist to stabilize the entire bone. What's the primary goal of inline traction? Avoid further neurovascular compromise. Which sign or symptom should give you a high index of suspicion that a patient may have compartment syndrome? Disproportionate pain. Which of the following is a drawback of an air splint? Temperature changes affect air pressure in the splint. Skeletal muscle is also referred to as striated muscle. You respond to a soccer game for a 16-year-old male with severe ankle pain. You deliver him to the hospital. The physician tells you he suspects a sprain. This means stretching or tearing of the ligaments with partial or temporary dislocation of the bone ends has occurred. Young male has musculoskeletal injury and unresponsive. You will not be able to assess sensory and motor functions. The purpose of splinting a fracture is to prevent motion of bony fragments. A motorcyclist crashed his bike and has closed deformities to both of his mid-shaft femurs. He's conscious but restless, his skin is cool and clammy, and his radial pulses are rapid and weak. The most appropriate splinting technique for this patient involves securing him to a backboard. To effectively immobilize a fractured clavicle, you should apply a sling and swath. A patient tripped, fell, and landed on her elbow. She's in severe pain and has obvious deformity to her elbow. You should manually stabilize her injury. When treating an open extremity fracture, you should dress the wound before applying a splint. Which of the following musculoskeletal injuries has the greatest risk for shock due to blood loss? Pelvic fracture. A patient injured her knee while riding a bicycle. She's lying on the ground, has her left leg flexed, and is in severe pain. She cannot move her leg. Your assessment reveals obvious deformity to her left knee. Distal pulses are present and strong. The most appropriate treatment of her injury involves splinting the leg in the position in which it was found. Hypothermia is diagnosed when the core body temperature falls below 95 degrees Fahrenheit. Shivering stops and muscle activity ceases once the body core temperature reaches 90. Rough handling of a patient with severe hypothermia may cause which of the following dysrhythmias? Asystole. In the context of an environment that is 90 degrees with 85% humidity, what does moist, pale, cool skin indicate? There has been excessive fluid and salt loss. What is the first sign of heat stroke? Change in behavior. In which of the following environmental emergencies are you most likely to encounter laryngospasm? Drowning. What's the most dangerous and most common emergency in scuba diving? Air embolism. You're treating a patient who was climbing a 10,000-foot mountain when he began to experience severe, constant throbbing headache, ataxia, and extreme fatigue. He's nauseous, and as you assess him, he loses consciousness. Which of the following should you suspect? HACE, H-A-C-E. You suspect that the patient you're treating was bitten by a rattlesnake. What should you do first? Place the patient in a supine position. A person who stands outside in windy, wintry weather and wears only lightweight clothing is mainly experiencing heat loss by what method? Convection. When a person is exposed to cold temperatures and strong winds for an extended period of time, he or she will lose heat mostly by convection. Shivering in the presence of hypothermia indicates that the body is trying to generate more heat through muscular activity. All the following examples of passive rewarming except administering warm fluids by mouth. A woman has frostbite in both feet after walking several miles in a frozen field. Her feet are white, hard, and cold to the touch. Treatment at the scene should include removing her wet clothing and covering her feet with dry, sterile dressings. A 30-year-old male who's been playing softball all day in a hot environment complains of weakness and nausea shortly after experiencing a syncopal episode. Appropriate treatment of this patient includes all the following except giving a salt-containing solution by mouth. You're assessing a 27-year-old woman with heat-related emergency. Her skin is flushed, hot, and moist, and her level of consciousness is decreased. After moving her to a cool environment, managing her airway, and administering oxygen, you should cover her with wet sheets and fan her. It's important to remove a drowning victim from the water before laryngospasm relaxes because less water will have entered the patient's lungs. A 13-year-old girl is found floating face down in a swimming pool. Witnesses tell you the girl had been practicing diving. After you and your partner safely enter the water, you should rotate the entire upper half of her body as a unit, supporting her head and neck. Shortly after ascending rapidly to the surface of the water while holding his breath, a 29-year-old diver begins coughing up pink, frothy sputum and complains of dyspnea and chest pain. You should suspect and treat this patient for an air embolism. 3 ambulances respond to a golf course where a group of 6 golfers were struck by lightning. 2 are conscious and alert with superficial skin burns, Group 1. The next 2 have minor fractures and appear confused, Group 2. The last are in cardiac arrest, Group 3. According to reverse triage, which group of golfers should be treated first? Group 3. Which of the following is a normal change in pregnancy? Increased respiratory rates and decreased minute volumes. When transporting a pregnant patient in the 3rd trimester, how you should position her? On her left side. What events mark the onset of labor? When uterine contractions begin. If amniotic fluid is green, what does this signify? The presence of meconium. As you are delivering a head during birth, you observe the umbilical cord is wrapped around once around the neck. What should you do? Try to slip the cord gently over the head. What would the APGAR score be for a newborn whose body is pink but whose hands and feet are cyanotic, pulse rate of 98, cries but does not recoil from stimulus, and resists attempts to straighten hips and knees, and has slow respirations? The answer is 6. If a newborn's heart rate is 75, what should you do? Begin assisted ventilation with bag mask device and room air. What is a primary characteristic of eclampsia? Seizures. Which of the following is a sign that delivery is imminent? Crowning. Which of the following is a sign that delivery is imminent? Crowning. The answer to which of the following questions will help you determine whether delivery for this patient is imminent. Is this your first baby? The first stage of labor ends when the presenting part of the baby is visible. A 23-year-old who is 24 weeks pregnant with her first baby complains of edema to her hands, a headache, and visual disturbances. When you assess her vital signs, you notice that her blood pressure is 160/94. She is most likely experiencing preeclampsia. You're transporting a woman who's 8 months pregnant to prevent supine hypotensive syndrome. How should you position this patient? On her left side. Immediately after delivery of the infant's head, you should check the position of the umbilical cord. Upon delivery of the baby's head, you note that the umbilical cord is wrapped around its neck. You should make one attempt to slide the cord over the head. The need for and extent of newborn resuscitation is based on respiratory effort, heart rate, and color. The 1-minute Apgar score of a newborn reveals that the baby has a heart rate of 90 beats per minute, a pink body but blue hands and feet, and rapid respirations. The baby cries when the soles of its feet are flicked and resists attempts to straighten its legs. You should assign a Apgar score of 8. The most effective way to prevent cardiopulmonary arrest in a newborn is to ensure adequate oxygenation and ventilation. While assisting a woman in labor, you visualize her vaginal area and see an arm protruding from her vagina. She tells you she feels the urge to push. You should cover the arm with a sterile towel and transport immediately. A newborn is considered to be term if it is born after 37 weeks and before 42 weeks. With which age group should you talk to the child, not just the patient, while taking the medical history? School age. Which of the following statements is true about a child's breathing? Because less air is exchanged with each breath, detection of poor air movement or complete absence of breath sounds can be difficult in a pediatric patient. What does the PAT assess? Appearance, work of breathing, circulation. What should you use the Wong-Baker-Faces scale to determine? Pain level. Which of the following does RSV cause? Bronchiolitis. You're assessing a 6-year-old boy who has a fever of 102 and showing signs of altered LOC. He complains of pain when he tries to turn his head. Which condition should you suspect? Meningitis. In a normal adult, greater than 34 to 40% of blood volume loss significantly increases the risk of shock. What's that threshold for blood volume loss in children? 25%. You're using Jumpstart in a triage situation involving several children. How would you tag a patient who is breathing spontaneously, has a peripheral pulse, and is appropriately responsive to painful stimuli? Yellow tag. You're responding to a 911 call where the mother reported finding her 3-month-old daughter cyanotic and unresponsive in her crib. When you stimulate the child, she responds. This is an example of which condition? Apparent life-threatening event. If a pediatric patient begins seizing again during your care, which of the following should your treatment priority? Secure and clear the airway. How does this pediatric anatomy differ from an adult anatomy? The head is proportionately larger. When a small child falls from a significant height, the blank most often strikes the ground first. Head. When assessing a conscious patient, 9-year-old child, you should allow the child to answer your questions. The purpose of a shunt is to minimize pressure within the skull. Which of the following statements regarding febrile seizures is correct? Febrile seizures usually last less than 15 minutes and often do not have a postdictal phase. You respond to a sick child late at night. The child appears very ill, has a high fever, and is drooling. He's sitting in a tripod position, struggling to breathe. You should suspect epiglottis. Treatment for a semi-conscious child who swallowed an unknown quantity of pills includes monitoring the child for vomiting, administering oxygen, and transporting. When using the mnemonic child abuse to assess a child for signs of abuse, you should recall that the D stands for delay in seeking care. A 4-year-old girl fell from a 2nd-story balcony and landed on her head. She's unresponsive, has slow, irregular breathing, a large hematoma to the top of her head, and is bleeding from her nose. You should manually stabilize her head, open her airway with the jaw thrust maneuver, insert an airway adjunct, and begin assisting her ventilations with a bag mask device. The AVPU scale is used to monitor a patient's level of consciousness. What does the P stand for? Painful. Which interview technique should you use when addressing a geriatric patient? Listen carefully to the answers the patient provides. You're assessing an 80-year-old patient who explains he was awakened by a sudden feeling of suffocation and respiratory distress. These symptoms are characteristic of paroxysmal nocturnal dyspnea. Which of the following is a non-controllable risk factor for stroke? Age. In arteriosclerosis, overproduction of abnormal collagen and decreased quantities of elastin lead to decreased coronary artery perfusion. Which of the following statements is true regarding delirium? Memory remains intact. You're working on a geriatric patient who reports severe abdominal pain radiating through her back and flank. She also reports discomfort in her right leg. And your assessment reveals diminished pulse in this extremity. Which should you suspect? Abdominal aortic aneurysm. Which of the following groups is most likely to commit suicide? White males older than 85. Which of the following should be the S part of the GEMS diamond? Activities of daily living. During auscultation of the patient's lungs, you hear crackles. The lung sounds are caused by air passing through fluid in the alveoli. Which of the following questions should you ask if you suspect a patient may have congestive heart failure? How many pillows do you sleep on? The least common cause of death in patients over 65 is drug overdose. According to the GEMS diamond, a person's activities of daily living are evaluated during the social assessment. A condition that clouds the lens of the eye is a cataract. You're called to a neatly kept residence of an 80-year-old woman, lives by herself. She burned her hand on the stove, experienced full thickness burn. When treating this patient, it's important to note that slowing of reflexes causes a delayed pain reaction in older people. A 71-year-old man with a history of hypertension and vascular disease presents with tearing abdominal pain. Blood pressure is 80/60, heart rate 120, respirations are 28. Your assessment reveals his abdomen is rigid and distended. Considering his medical history and vital signs, you should be most suspicious for aortic aneurysm. Which of the following is physiologic change that occurs during the process of aging? Decline in kidney function. Which of the following conditions makes the elderly patient prone to fractures even with minor trauma? Osteoporosis. Polypharmacy is multiple medications. Inflicted bruises are commonly found in all of the areas except the forearms. Which of the following should be used when communicating with a patient with autism? Speak normally and provide simple one-step directions. What does TEAM acronym stand for? Treat, evaluate, administer, monitor. Nerve damage to the inner ear results in sensorineural deafness. You're at home, elderly man, tracheostomy tube, mechanical ventilation. Ventilator has malfunctioned. Once you disconnect the ventilator, you should deliver oxygen using a face mask over the stoma. Patient with epilepsy is likely to have which of the following medical devices? Vagus nerve stimulator. Epilepsy. Vagus nerve stimulator. Which of the following is the best source of information when dealing with an autistic patient? Family members and caregivers. Which of the following mnemonics is helpful when dealing with tracheostomy tube obstruction? DOPE. What does Emergency Medical Treatment and Active Labor Act dictate? EMTALA. All healthcare facilities must provide medical assessment and treatment regardless of the patient's ability to pay. When you are treating a patient with spina bifida, which is the most likely to produce anaphylaxis? Latex. What's the best way to transport an obese patient with the head elevated? Which of the following developmental disorder characterized by impairment of social interaction? Autism. Known risk factors for Down syndrome include increased maternal age. Which of the following may be difficult to perform on a patient with Down syndrome? Intubation. Most patients with this disease also have hydrocephalus, spina bifida. What does DOPE mnemonic help you recognize? Causes of airway obstruction. What device placed directly into the stomach to feed patients? Gastrostomy tube. What do vagal nerve stimulators do? A and C. Act as alternative to treatment to medicine and keep seizures from occurring. An important part of the assessment process for a patient with special needs is to interact with the caregiver. What improves a patient's quality of life shortly before death? Comfort care. The EMTALA Act states that all patients must be treated regardless of their ability to pay for care.